So another scenario that comes up often that we discuss in group appointments is it adrenaline or sympathetic or anxiety? It can be challenging. One is that 20% of our society has anxiety, maybe even more since the times that we're living in over the last few years. Two is that when you have a major chronic health condition, there's tremendous upheaval, especially when it impacts people in the prime of their life. So, economic challenges, uncertainty of healthcare, um, getting people to understand you, believe you, finding the right medical team, insurances, unpredictability, just the word uncertainty, not knowing what the day can be, all that can create what you call chronic health uncertainty or anxiety. So, just being sick can create anxiety and depression. So all that can sometimes lead to people who are ill just to develop anxiety. It doesn't mean that your anxiety caused your condition or your symptoms. So people who have sympathetic or adrenaline as a response to orthostatic conditions will often have symptoms to compensate to get the circulation going. You'll have adrenaline pulsing to keep the blood pressure going and the heart rate going to keep the circulation going. Some of the symptoms that occur are chest pain, racing heart rate, jitteriness, um, sweatiness, your nausea, can't think. You just feel a sense of feeling off, not well. These symptoms can mimic anxiety. So it's important for people sometimes to sense will be at a point with their whole life being an upheaval. Maybe they've had some prior anxiety, or they just don't know what is the medical condition, what is just life hitting at them, and what is anxiety. What is anxiety? What is adrenaline? What is sympathetic? How to figure it out. That's where sometimes journaling can be helpful. I'm having a symptom and figuring out what is triggering what, or writing down the variables, maybe just writing down what is going on in your life that's maybe making things better or worse. But typical patterns you'll see if someone has a sympathetic or adrenaline compensation, you'll notice that those symptoms are worse when you change positions, going from sitting to standing up. You get more jitteriness, more dizziness, more lightheaded, more woozy, more those symptoms when you go from going upright because you are needing that compensation. Or you might notice from prolonged sitting or laying down that you're having the symptoms because the body's not moving, you're not moving the muscles around to compensate. They're not moving the body around to compensate. So prolonged sitting or laying around, just sleeping, resting, long car rides, air flights, sitting on the sofa to watch a movie, you might have it just because the blood's not moving. So pay attention to those aspects. But really thinking about what's going on in your life because there's a lot that's happening to you when you're sick, just in terms of life upheavals and stressors can be a factor. So it's important to really try to figure out what is what, and it's not easy. It can take time, time. So a little tip in that level.